So to start with this, uh, what is the difference between Indian and national care systems? Is it social care or is it a regulatory responsibility?
So let's first try to understand, that the healthcare systems in India vary from, say, example, the British healthcare system. I mean, we'll talk more about the British healthcare system because I'm more familiar with that particular concept. But of course, there are similarities in some of the European care systems, maybe Australia, Canada with UK. The American care system is basically more privatized, so that's basically more maybe similar to India. But systems are basically established internationally. Due to an evolved social care system, a sizable aging population, or maybe also focus on equal opportunities for all people in the community. So I will talk as UK as an example because the Care Act in the UK of 2014 basically provides the guidelines for all the care organizations and the care practices basically to provide guidance to promote health, look at prevention, look at early detection, look at integration of services, and main focus is basically on person-centric care. This is based on individual needs, and then the final aspect is safeguarding. So this regular activity is then implemented by a body called the Care Quality Commission, CQC as we call for short. So I would be discussing about the community care systems, either that are residential or home-based. Simply put, I can give you about three examples. We can look at somebody who has dementia. Somebody who has dementia basically is a person who is having now memory issues, and then they're slowly regressing in terms of, general functions and everything will come down. So these are people who are vulnerable, who, the guidance will be there to protect them in terms of safeguarding, maybe from abuse, have them to have access to basically services, and give provision for care. Then, the other example would be somebody who has autism. So autism again is very established here in the UK. You have systems in place, organizations that look after, and support people to be independent. Also look at things where, there's complexities of services. And then maybe another example I give is reablement support. Say, for example, I meet in an accident and I'm admitted in an NHS hospital, and I then have to look at, cast. I have a fracture and there's a cast, a surgery. Now I have to have rehab. So I'll be having like quick rehab initially for maybe a few weeks, and then I will then be sent home with 6 weeks of support and care, which is basically part and parcel of the system. So I'm basically coming back to baseline. So this is basically how established the care systems are here. Now, in addition to that, there are established training mechanisms, monitoring, surveillance, enforcement systems in place to protect people. Because at the end of the day, vulnerable people are more, susceptible to be abused because of what where I do things. Now, when we look at India, I believe there are formal and informal, systems in place here, but not a policy framework. I mean, we are yet to see a great uh, interest from a policy level implementation. Some states do have their own policies, like the state of Kerala has its own mechanism in place. But today, when we look at home care or care, it's largely medical care at home. This is my opinion because it's not real home care in the sense of it. So when
Correct.
somebody needs care, they ask the help of the family here, or there'll be a home help, and they may not be able to structure this as well because it depends on the access to knowledge. If I am aware of what I have to do with somebody with dementia, I will be able to deliver those kind of services. Unlike what's happening in the current scenario. Dominantly, the NRI or the elite are basically able to afford care in organizations as the cost for this is considerably high in India. So in UK, basically, these are all state sponsored, or if you have money, then you can look at private support, but it is still then subsidized to some extent. Um, so basically, because the cost is high and considering that it's not client centric and is very medicalized, it seems to have catalyzed from the COVID pandemic rather than actually evolving into proper home care. So I think the government also has developed a good curriculum for training, but then this implementation strategy is not seem to be working. So I would say that the care system in India still needs a level ground focus on training of care workers and moving towards developing a strong policy focus and regulation.
Great. I think that was a very good introduction.